we have made progress in our transition to living with COVID, but there's still some way to go. There are positives and there are negatives, and let me highlight them. On the positive side, first, the cases have stabilized for the last 2 weeks, in fact, slightly more than 2 weeks. Yesterday, we had the usual terrible Tuesday, which is the post-weekend spike, so we have about 3,500 local community cases. Today's numbers are being finalized, but appear to have moderated, but still slightly above 3,000 local community cases. So we have to monitor the trend over the next few days to understand where is the trajectory of the infection, of the transmission. The important thing is it is no longer doubling every few days, like what we have seen in late September and early October. But the top line of infection numbers are actually less important. What is critical is how the top line translates into the bottom line of how many patients fall seriously ill and need hospital or ICU care or die. That leads me to the second positive, is that there is now a higher percentage of infected persons with no symptoms or mild symptoms. This percentage used to be about 98%. It has now risen progressively, and now is, over the last 28 days, the percentage is now 98.6%. And the remaining 1.1% needs oxygen supplementation, 0.1% needs ICU care. So a smaller percentage of patients are becoming severely ill, and that is a good positive trend. Third positive is that amongst the seniors who are vaccinated, seniors 60 and above who are vaccinated, the number getting infected has been falling. At its peak, which is early October, we get 1,000 vaccinated seniors being infected in a day, 1,000. Yesterday, this has fallen to 279. We think this is a combination of a few factors. One, seniors, they are cutting back on their social activities. Second, and I think is a major factor, is because of the boosters they have been receiving, which is fobbing off infections. Now let me talk about some of the negatives that are still around. First negative, there is still no sign of cases falling. This will take time. As more people get boosted, as individuals who are vaccinated catch the virus and experience only mild flu-like symptoms, the antibodies and the immunity in our society will build up over time. And when that happens, you will see cases falling, and then we can open up social economic activities without cases rising very rapidly. And then we will have achieved a new equilibrium with the virus. And that is what we are working towards. Second negative is that our hospitals and healthcare workers continue to come under pressure. Our 2,000 isolated rooms are 81% filled. Queues have formed for COVID and non-COVID patients needing hospital beds in certain hospitals. We have stood up 207 ICU beds. 71 are occupied by patients who are intubated. That means they need ventilators to help them breathe. They stay an average of 15 days, but the longest, they stay up to a month. There are another 75 who are not intubated, but have been admitted to ICU because they require close monitoring and treatment by ICU-trained healthcare workers to prevent further deterioration. The DMS mentioned it in our last press conference. So the workload on healthcare workers and hospitals is therefore very significant. Third negative, the number of infections amongst unvaccinated seniors aged 60 and above continues to be high. So this is in contrast to vaccinated seniors, where the numbers are falling, But for unvaccinated seniors, the infection numbers continues to be high. They account for 2/3 of patients in ICU and who have died. So over the past 5 days, the number of infections amongst this group averaged 127 a day. 127 a day. And for them, the disease is not 98.6% mild. For unvaccinated seniors in their 60s, our data show 1 in 4 will require oxygen, ICU care, or will succumb. The risk go up to 1 in 3 for those in their 70s, 1 in 2 for those in their 80s or older. Once an unvaccinated senior is on oxygen, more than 1 in 5 will go on to need ICU care or die. So I hope with the vaccinated differentiated measures implemented recently, it will bring this number down, bring this number of infections of unvaccinated seniors down. But hospitals are no doubt bracing themselves for a sustained heavy patient load. MOH is doing whatever we can to support and bolster the hospitals. If need be, we will open up more ICU beds. The next leap will be to 300 beds, but that will be at the expense of further degradation of normal service and normal medical care. We are beefing up manpower through redeployment, using former swabbers as patient care and healthcare assistants. We're tapping on the help of SG Healthcare Corps, where 2,000 people have signed up and about 800 are ready for deployment. Our hospitals and healthcare workers will need the help from the rest of Singapore to keep caseload steady, not overwhelm the system, so that we can continue to do our best to give proper medical care to all patients, COVID and non-COVID. Thank you.
Good evening. We've explained earlier that we can relax the restrictions only if the pressure eases off on the healthcare system. And as you heard from Minister Ong just now, the healthcare situation remains under pressure. To give a sense of what the system is like today, I'll share 2 indicators. One, nearly 90% of isolation beds have been filled, 90% of isolation beds in our hospital system have been filled. 2, more than 2/3 of our ICU beds are already occupied. So that's where we are with our healthcare system today. We are trying to add capacity, but it's not simply a matter of having extra beds or purchasing new equipment, because as you heard just now, our medical personnel are stretched and fatigued. And while we are trying to reinforce the team, it will take time for these reinforcements to come in. And at the current situation, we face considerable risk of the healthcare system being overwhelmed. That means that we do have to continue with the stabilization measures beyond 25th of October for another month. It doesn't mean that all the measures will have to remain frozen or static throughout this entire month, because we will continually review the situation in the coming weeks to see if there is any scope for calibrated easing. And in instances where the risks are acceptable, in some of these settings or where there are measures where certain risks are acceptable, we will consider moving first on these measures. For example, the Restaurant Association of Singapore has requested to allow members from the same household to sit together in a restaurant in a table of 5. We understand where the Restaurant Association is coming from. For now, we think it's still too risky to make such a move because of the pressure on the healthcare system. But it is indeed something we are looking into. Meanwhile, MOF will provide a further support package to help all affected businesses and workers because of the extension of our stabilization measures. The components of this package will be similar to the earlier one. In other words, there will be a 25% job support scheme support. There will be a half-month rental relief for qualifying businesses, which will include your hawker and market stall holders. And there will be support for taxi and private hire car drivers. The cost of this package is $640 million. It's similar to the last round. And we will fund this package through upside in our revenue, like what we had done previously. We know this is a difficult time for everyone. In many ways, I would say this is probably the most difficult phase in our journey through COVID so far. But this phase will not last indefinitely. At some point, the wave will peak. We will also have better immunity against the virus as more people get exposed to it, and we will have more people getting boosters over the coming weeks. So let's continue to have faith that the situation will get better. And in the meantime, we seek everyone's understanding of why we need the measures that we have today, and also your support to protect, importantly, our healthcare system and our healthcare workers. Thank you.
Thank you, Ministers. We will now begin the Q&A segment. Dear members of the media, as mentioned earlier, the doorstop will be shorter than the usual press conferences that we have. Hence, we will not be able to take as many questions, and we seek your understanding to ask only questions related to the content of the doorstop. Please remember to use the raise hand function on Zoom if you would like to ask a question, and a reminder to keep to one question only. If you are called upon, you will be prompted to unmute yourself. Please do so accordingly. May we have the first question from Timothy of ST, please?
Thank you, Ministers. Now, last week when the vaccine differentiated measures at hawker centres and coffee shops were implemented, we spoke with hawkers and patrons on the ground who said that this system adds additional workload on already overworked hawkers and stall operators. Will we be making any adjustments to this? And why has the government not used POFMA on websites encouraging people to take ivermectin? Thank you.
Didn't hear the last part of the question. Everything was clear except the last part.
Something about POFMA. Can you repeat that slowly?
Thank you. Why has the government not used POFMA on websites encouraging people to take ivermectin?
Oh, POFMA. So let me take the first part of the question around implementation of the vaccination differentiation measures in hawker centres and coffee shops in particular. We are trying to do this in a pragmatic way, and we know it's not straightforward, particularly in many of our coffee shops which have open, porous designs. It's not easy to do, and that's why NEA and SFA, the agencies in charge, will take a pragmatic approach. They have been engaging the operators of coffee shops as well as the hawker centres, and they will continue to fine-tune the implementation system. We know this is not easy. That's why we didn't start out wanting to do VDS in hawker centres and coffee shops. But it was because we saw the numbers of people who were being infected in these settings, and many of them were unvaccinated individuals, that we felt there was a need to safeguard and protect them. And that's why we decided to do so. But in the implementation, we will certainly take in feedback and see how we can fine-tune the implementation process.
Thank you for raising the issue about ivermectin and the possibility of POFMA. We are certainly looking into it. And just to be clear, in MOH, the medical professionals are very clear that ivermectin is not suitable for the treatment of COVID. And whatever that's been used in the lab to kill the COVID virus is at a dosage that's too high for humans to use safely. So we will look into it.
Thank you, ministers. Can we have the next question from Chun King of Zhao Bao, please?
Good evening, Minister. My question is, do we know if eligible persons, especially the elderly, are coming in for their booster shots on time, or are we seeing a delay? And how do we ensure that elderly are not putting off their booster shots? Thank you.
So far, thank you. So far, it has been very encouraging. As you know, we shoot out the invitations about 5.5 months, not the full 6 months, to the seniors, so that by the time they book and they come in, it will be around 6 months. So the first batches that we have sent, the response rate, meaning those who have taken their boosters or booked an appointment, is well over 80% already. For the later batches, they still have some time, but they are increasing day by day. So far, the response has been very good.
We will now take the last few questions. Next, we have Cheryl from CNA, please.
Good evening, Ministers. I would like to ask, given the current situation where the healthcare system is still under stress, what is the plan for public hospitals to manage manpower of healthcare workers as they go on leave, and if and when they are allowed to travel overseas? How will this be prioritized? And does the public hospitals plan to tap on staff from private institutions? Thank you.
Thank you. Thank you for the question on healthcare workers. They've been really under pressure for the last 20 plus months. I think most of, if not all of them, have not even taken leave. Our foreign nurses and healthcare workers have not had a chance to see their family. So even though workload is so high and every single of our healthcare workers is needed at their station, we do have to take care of their well-being as well, which is why MOH have also issued a circular to allow and to ask the clusters to start rostering them to go on leave towards the end of this year. And I think it's much needed relief for the healthcare workers. From now to then, as I mentioned briefly in my talking points, is we do need to beef up the manpower so that we can provide relief to them. So I mentioned some of the possible measures, and in fact the measures that we are already taking. As we cut down on PCR testing, many swabbers actually becomes available. They are infection control trained, which is very useful, so they can be redeployed as healthcare assistants or patient care assistants. We are also looking at, we call out to healthcare workers out there to step forward as volunteers through the SG Healthcare Corps. 2,000 people have responded, and we have identified 800 plus who are suitable and waiting for deployment. You mentioned one thing which I forgot to mention in my talking points, which is we are also tapping on private sector. The private sector healthcare companies have been a great help. They've been helping us with vaccination operations, swabbing, as well as operation of the CTFs, as well as CCFs. So they have been a great help, but we have also reached out to them to also help take in some patients, COVID and non-COVID, so that we can share the burden as one healthcare ecosystem. So through various means, we hope that towards end of the year, healthcare workers can be given a reprieve.
Thank you, Minister. Can we have the next question from Su Xuan of Channel 8 TV, please?
Hello, good evening, Ministers. Can I request a Chinese soundbite for the content today, particularly on the healthcare pressure? And my question is really on the ART test for the primary school students, where they are now required to take this ART test every 2 weeks. So parents are wondering what is the rationale behind this and why primary school students? Thank you.
Lawrence will take the ART while I think of the Chinese soundbite.
So on the regular testing, it's something that we have put in place in areas where we think there are, where people come together. And in the school setting, while there are very stringent safe management measures in place already, and they continue till today, having that additional layer of protection where students and staff get themselves tested regularly will help minimize the spread of the infection in the school and cause large clusters in these settings. So we do think these forms of testing that can be done regularly, particularly through the ART, it is not very difficult to do, and it can be self-administered. These are ways in which we can continue to, as much as possible, carry out normal activities, but ensure that these are done safely.
Thank you. 让我用华语讲解一下。我们在控制疫情的这个过程中有了进展，但是这条路还有一段要走。有正面的发展，也有负面的发展。正面的发展呢，第一，现在的每天的病例比较稳定。过去两周呢，我们没有看到病例非常迅速的增加。第二呢，就是现在那些感染了，但是得到没病状或者轻微病状的百分比呢增加了，现在是98.6%的病患者没有病状或者轻微的病状，比以前的98%高出了一些。第三呢，那些接种了疫苗的年长者，他们被患上冠病的数目减少了。10月初的时候，一天呢，最高的一天，高峰的一天，有1000个接种过疫苗的年长者得到了冠病。昨天呢，已经跌到279，是大幅度的跌。我看一个很重要的因素，是因为追加剂的因素。但是负面也有。第一个负面就是，虽然病例平稳，但是还没有下降，还需要一段时间。第二呢，更重要的一点就是，我们的医院还有我们的医护人员承受了很大的压力。我们有2000个隔离病床，现在已经超过80%已经是有病患者。我们有 ICU 的病床207个，71个已经有病人在病床上了，他们都是需要人工呼吸的。另外呢，还有75位也是需要 ICU 病床，他们虽然不需要人工呼吸，但是需要非常仔细的观察，需要我们 ICU 训练过的医护人员来给他们照顾他们。所以对我们的医院跟医护人员这个压力是相当大的。第三呢，就是那些还没有接种过的年长者呢，他们所每天的病例还是相当的高。好像过去5天呢，那些没有接种的年长者就有平均127位受到感染，127位里面10到20位会需要 ICU 病床，甚至会死亡。所以卫生部呢会尽量的支持我们的医院，尽量的调动人员帮助我们的医院。我们也呼吁所有的在外面的还没有在外面的可以在医院工作的医护人员前来贡献他们的力量。所以一共有2000个医护人员已经挺身而出跟我们报名，其中呢有800名我们可以开始调动去加强我们的医护人员的团队。我们的医院呢，医护人员需要所有新加坡人的支持，把我们的病例稳定下来，不 把整个体制呢淹没掉，承受不起接下来的压力。所以这样一来，我们就可以尽心尽力的为所有的病人，冠病也好，非冠病也好，为我们所有的病人做出最好的医疗跟服务。谢谢。
Thank you, Ministers. Can we have the final question from Annabeth of BT, please?
Hi, good evening, Ministers, and thank you for your time. So my question is about the strain on the healthcare system. I just wanted to make sure I understood correctly, given that Minister Ong said that there are 207 ICU beds now occupied by 71 intubated and 75 non-intubated COVID-19 patients. I'd like to clarify whether the figure of 207 ICU beds it refers to all ICU beds nationwide or only COVID-19 beds, and if this includes non-COVID-19 beds, the remainder of the beds, surely there are also non-COVID-19 patients. So at this point, what is the government's plan, if any, to transition to any triage or crisis standards of care, as has been done in other countries which suffered strain from COVID-19 on the healthcare system? What's the plan to do so, and what can Singaporeans expect? Thank you.
Can you just repeat the part about triage and speak a bit slowly? It's just not very clear.
Okay, sure. So I wanted to clarify whether the 207 ICU beds that Minister Ong mentioned includes beds for non-COVID-19 patients, and if so, what's the cumulative level of occupancy for the ICU? And given the high levels of occupancy in the ICU and regular hospital beds, what plans, if any, does Singapore have in terms of when we might need to transition to such standards, what that would look like, and so on and so forth? What plans there are in such a situation, and whether we are coming close to that?
Yeah, thank you. I don't have the benefit of DMS with me. He will be in a much better position to answer. But to answer your question, the 207 are COVID beds. It does not include the non-COVID patients. So the numbers we mentioned, 71 plus 75, these are COVID patients occupying these 207. So in total, it's about 67% occupancy. As the numbers grow, and we need to, so two things. One is the numbers grow and we need to set aside more COVID beds to take care of COVID patients. We can do so. We have the capacity to do so. But there is a cost, which is, it is often at the expense of what we call BAU or business as usual medical care. So electives are starting to be postponed, and if we have to beef up ICU or isolation beds, I think there will be a greater reduction of normal medical care, non-COVID medical care. So that's one thing we have to be mindful of. And there are also non-COVID patients that require urgent medical care. Yeah. Second is triage. We have been doing so, and as the numbers go up, our triage system have to deal with quite huge numbers. So every day, actually, the biggest triage happens at home recovery program, where we can channel almost 3/4 of infected persons to undergo home recovery care with the help of telemedicine and emergency service should they do so. And they more or less now can go through home recovery quite smoothly and uneventfully. As for those who need hospitals, you need a further triage to see who needs to stay in hospital, who can actually decant to what we call the COVID treatment facilities, where there are medical personnel, but it's one step lower because these patients are generally healthy, but belong to a higher risk group that we need to observe. But when it comes to ICU, hospitals will only admit those who really need that close observation and need that care by ICU-trained healthcare workers. So the ICU numbers, I don't think there is much scope to triage them away, and we just have to give them all the appropriate medical care that they need.